So that's why, there's been efforts to, these outreach efforts and, kind of bringing services right into the shelters. I mean, in fact, we even have shelters, like we have a shelter here in Ottawa that includes a palliative care unit. Um, um, it's almost, and this is where I think long term it can be problematic, is you're starting to set up a parallel system rather than people, getting integrated into the main system.
I work with a colleague who is a global health nurse, and they're in the global health nursing world, are looking at the challenges that have brigade type work has done. That drop in, fix this problem, drop
Yes.
out. And it feels somewhat like that in the homelessness. Here's the problem we've identified. We're going to jump in here and fix it, and then we're going to pull out because of the funding ends. And so there isn't that continuous, this is life for these people, for folks,
Absolutely.
right? And
And the
so,
other, no, absolutely. And I was going to say the other part to that, is which is endemic in our systems, our social service systems that work with people who are homeless, is this treatment first kind of perspective, that we need to fix people's mental health problems. We need to fix people's addictions, because otherwise they're not going to be able to have their own place. And this has been, I think, the revolutionary part of Housing First is it turns it on its ear, because it says, no, start with the housing. And then once people have a place and they've got some stability, let's work on, absolutely, let's work on the health issues and the addiction issues and so on.
well, and let's see how many of the health issues maybe not go away, but decrease as that, that chronic stress that
That's right. That's right.
and
Yes.
see where the person really is at before we start trying to treat this very high level of needs because they have the added anxiety and stress or depression on top of that.
Yeah. Yeah. No,
Yeah,
exactly. That's
yeah.
exactly the case.